AIDS today. The 1st of December is World AIDS Day. The theme, End Inequalities, End AIDS and End Pandemics. A lot of our coverage will focus on the local, continental and global acts of commemoration and activism. Let's start the show.
End Inequalities, End AIDS, End Pandemics, World AIDS Day.
And as we start the show, just to look at some numbers that have come in from UNAIDS, are saying that people living with HIV are at the highest risk of contracting HIV/AIDS. Also saying that 53% of all people living with HIV are women and girls. Can you believe it? And a worrying statistic there. More numbers coming in. 680,000 people have died from AIDS-related illnesses in 2020, and that 1.5 million people became newly infected with HIV in 2020. But the UNAIDS reporting that the new infections have been reduced by a whopping 52% since the peak in 1997. Some more numbers, 28.2 million people are accessing antiretroviral therapy as of the 31st of June 2021. So some progress there, and UNAIDS saying that 37.7 million people globally are living or were living with HIV/AIDS in 2020. Some numbers to get you thinking there, but let's take you to this story. The Deputy President David Mabuza, in his capacity as Chairperson of the South African National AIDS Council, SANAC, leading the official commemoration of World AIDS Day at Saselamani Stadium in Xikundu in Limpopo. The national theme for this year's commemoration is working together to end inequalities, AIDS, TB and COVID-19, get tested, get vaccinated, adhere to treatment. The theme emphasizes the need for individuals to make the right health choices by undergoing testing for HIV, TB, and sexually transmitted diseases. For more on the story, let's cross live now to our colleague, Lutendo Bobodi. Lutendo, a very good morning to you. Give us a sense of occasion.
Well, you said a very bright morning. It's a very hot morning here. We are above 30 degrees Celsius here in Xikundu. This is a beautiful area just on your way to the Kruger National Park, the glorious and iconic Kruger National Park. This year, of course, event is hosted here. As you said, the Deputy President, David Mabuza, he'll be here. We are told that he's already here. He's now with the royal family. From there, he's going to do a door-to-door, as we said earlier, trying to drum up the message of COVID-19 and, of course, HIV/AIDS. We spoke about challenges earlier. In the earlier show, we spoke about challenges that the country in general and Limpopo in particular are facing in terms of trying to fight this HIV/AIDS. Of course, in the midst of COVID-19, it's been a major challenge. It's been an uphill battle, with a lot of people living with HIV not wanting to visit health facilities to get their medication. Earlier, we spoke to the MEC for Health, Dr. Tuba, who said that the PrEP's medication is gathering cobweb in shelves, in hospitals and clinics, because people are not going there as a measure, of course, to defend themselves against the scourge of COVID-19. So many challenges, a confluence of them. One of the challenges, of course, that we spoke about is undocumented foreign nationals that are not easy to trace. Once they're tested with HIV positive, you've got NPOs that follow them just to try and help government trace them. But they're nowhere to be found. They change addresses, after addresses, because they're running away from justice, they're running away from police, they're running away from the law. But for now, I'm joined here from SANAC. I'm joined by Reverend Zwoitwaho Nevhutalu, who's decked out in a beautiful shirt. Thank you so much. Very good morning to you. We spoke about one of the major challenges, trying to trace foreign nationals that are not documented in South Africa, and the health authorities feel that in not tracing them and finding them is helping spreading the HIV/AIDS. Talk to us about it.
Yes, actually this is a challenge that the Department of Health alone is not able to deal with it. That is why in SANAC we spoke about the multi-sectoral response. And the theme for this year is working together to end inequalities, HIV, STIs, TB and COVID-19. So it's a call to communities. These foreign nationals that you are talking about who need to access treatment are actually in our communities. And the Deputy President has actually started very well in terms of engaging with faith-based sector leaders, interfaith, engaging with traditional leaders, and extending this call to say that all the people who are in the country, the message is very, very simple. We must all avail ourselves to test for HIV, TB screening. We must avail ourselves for vaccination. And those of us who are on treatment must adhere to the treatment. And that is a big message. Everyone, irrespective of their nationalities. We are members of the global village now. And as you know, that this epidemic knows no boundaries. So we need to get everybody in the country to get tested, to get vaccinated, and to get treatment and adhere to the treatment.
Of course, we said earlier that the UNAIDS had scaled up the targets in terms of wanting to see a number of people taking antiretrovirals, and about 95% of those across the world with depressed viral load. How are we faring in South Africa in terms of that?
You will remember that by the end of 2020, the UNAIDS targets 90. They have now raised the bar to 95. The country, as a country, in terms of the 90, we only reached 190, which is the first 90 of people who have tested and are aware of their HIV/AIDS status. But we are struggling with the second 90. In other words, 90 people who are aware of their status who are supposed to be on treatment. We are not there yet. And also the last 90, we are not there yet. But now we have to work harder. That is why the South African National AIDS Council has actually established what we call catch-up plans, because COVID has had a huge impact on our HIV, STI and TB response. And now we are working on, I can say it's Operation Shesha. It's a catch-up plan so that we can be able to work even much more harder to even reach the bar that has been raised by UNAIDS of 95. It's no longer 90. It's now 95. And we are still looking forward to ending HIV as a public health threat by 2030. So we are still on course. And if we are on course, we have to meet all these targets that are being set in the interim.
And HIV/AIDS has left lots of children orphaned. Some of them are HIV positive, some born with HIV. Do you have any programs to support these children?
Yes, the programs are there. I spoke to you that it is multi-sectoral response, which means that government departments are also part of SANAC, and 22 of them are actually part of SANAC. And that responsibility of taking care of AIDS orphans or youth-headed household rests with the Department of Social Development. And they do have a very good program. But of course, we know that also the Department of Education, basic education, is very critical, because they need to ensure and follow up and make sure that these kids don't miss up schooling because of the early parenting that they have to do. We also invite the churches as well. As I said, this is working together. So in other words, the churches are also invited to offer support to those children who are taking care of their own siblings, and also traditional leaders are also being invited, because especially in rural communities.
Thank you so much, Desiree. I've not been exercising. It's just hot here. I'm talking about over 30 degrees Celsius right now. Of course, we're still waiting for the Deputy President. He's expected to be here at about 12 o'clock. We hear that it's going to be 2 hours late. He was scheduled to start this program at about 10 o'clock, but because of some delays, as you can see, they've just finished putting up that tent. So there have been some delays, but by 12 o'clock, we're quite confident that this program will be starting. That's right.
Lutendo, I don't blame you. I wouldn't survive in those kind of temperatures, but thank you so much for setting the scene for us there. Of course, SABC News will take you through, as you just heard, the Deputy President will only be making his way around the time that our show concludes.